Hi everyone, I wanted to share with you a great study that was just presented at the ESMO Breast meeting. So ESMO is the European Society of Medical Oncology, and their breast cancer specific meeting is ongoing right now. Now I'm not there, but I've got some of the data that's coming out. I'm going to share one study with you now, and I'll be back this weekend to talk about studies about invasive lobular carcinoma and endocrine therapy, some data with rechallenging with trastuzumab deruxtecan, a new drug that we're awaiting approval for, datopotamab deruxtecan, and HER2-DX, which is kind of similar to Oncotype DX that might help us guide treatment for HER2-positive breast cancer. So stay tuned. ASCO is also coming up, and that is the American Society of Clinical Oncology, biggest oncology meeting globally. That's coming up in 2 weeks, so there's going to be a ton of information coming out, and that's all cancers for that meeting. But I do want to talk about one study presented at ESMO Breast looking at the safety of assisted reproductive technology in patients who've had a breast cancer diagnosis and have a BRCA 1 or 2 mutation. Assisted reproductive technology is really an umbrella term for all fertility procedures and techniques. So this study is called the BRCA BCY Collaboration. They looked at 4,700 plus BRCA carriers and all over the world, and they had 659 women who became pregnant after a breast cancer diagnosis. So all of them are BRCA carriers. And out of the 659 women that became pregnant, 436 conceived naturally and 107 used, again, some form of assisted reproductive technology, whether it be egg preservation before a diagnosis, in vitro fertilization after diagnosis, all of that. And the most important takeaway point was that there was no difference in disease-free survival, meaning being alive without disease, with a median or an average follow-up of 9 years. So that's a pretty long follow-up. We do know that cancer can recur after 9 years, but 9 years is a good follow-up, and it's really reassuring to see that there was no difference in outcomes in BRCA mutation carriers pregnant after a breast cancer diagnosis that used assisted reproductive technology compared to those who didn't. This study is really important because it adds to the body of literature telling us that assisted reproductive technology is safe in patients who've had breast cancer. It's fertility preservation before breast cancer treatment is safe, that postponing breast cancer treatment for a few weeks to do fertility preservation is safe, and all patients should be counseled and offered fertility preservation before breast cancer treatment. Another important point is that patients who have BRCA mutations may choose to undergo something called preimplantation genetic diagnosis, where they select embryos that do not carry a BRCA mutation. And so I think that this, again, adds to that counseling to those patients that this is something that is safe to do. Let me know your questions about fertility, breast cancer. Let's talk about it, and make sure you check back in for more data from ESMO Breast over the coming days.